they undid his mouth. And he was like, "You stabbed me," and he had like this plastic plate on his chest, so it missed his heart. And he legitimately stabbed him in those scenes. It's so good.
Maybe they'll. What's the actor's name for Dexter? I can't think of his name. Yeah, maybe they'll use him as a replacement for Russ.
Yeah, seriously.
That guy was really devoted to that.
I don't think Baldwin's gonna finish Rust. I don't think he's getting it. For a while there, I thought he was gonna get away with it. Now I don't think he's getting away with it. All right. Any questions on low energy penetrating trauma? Any questions? So that's an exit wound. That's someone trying to grab a gun. The entrance wounds in the palm, that's the exit wound at the back. Exit wounds are always going to be bigger than entrance wounds. Entrance wounds can almost be undetectable. Usually very small holes. Exit wounds are big holes. All right, you don't have to know this for the test, but it's good to understand it. Laws of physics. Objects at rest will stay at rest until something moves them. Any questions? Force equals mass times acceleration. Any questions? For every action, there's an equal and opposite reaction. Any questions? What is Newton most famous for, though, besides those laws of physics? Nope. Actually, it's figs. He made a sandwich out of figs with a crust on the outside. It's called fig Newton. That's where he made his fortune.
Delicious.
Yeah.
Paul even stole it later, right?
Huh?
Paul even stole it later, right?
Did he?
Yes.
I think he did the commercials.
Well,
All I know is when I was in first grade, we got taught not to have food fights because 4 years before that, someone lost an eye from the fig Newton. Yeah, it must have been stale. I don't know. Maybe it wasn't true. Maybe they were just trying to. You can lose an eye from a fig Newton if you get to keep having food fights. Not that I would ever partake in a food fight. Not really the type.
So you just sit there and video it. You like those guys? Just stay there. Just need to wait.
Actually, believe it or not, I thank God that there was no video when I was a child and teenager. It didn't exist. I'm really glad. I mean, it did exist, but it was like Super 8mm film. It was not exactly something you just did like nowadays.
It wasn't like something, it wasn't like you did something. Every years later, somebody said.
Somebody's got to have it on their shoulder, you know. All right. Injuries to the head. We're going to go over all of these in detail. The injury to the head can cause brain trauma. Injuries to the neck can cause permanent paralysis. Can also kill you instantly if you get air into the jugular veins, just because the vena cava traps air in your circulatory system, called an air embolus. Also, if you sever a carotid, you can bleed out pretty fast due to the carotid artery. Injuries to the chest can be very bad. They can collapse lungs, put pressure to your chest, fill the heart full of blood. And of course, any great vessel tears can cause you to bleed out in under 5 minutes. A pneumothorax is the collapsed lungs. You get air trapped in the chest, crushes your lung and heart. Usually fatal unless someone can decompress it. Yes.
With the, going back to the car accident history, how common is the injuries to the chest with the steering wheel causing like any?
Well, believe it or not, nowadays the modern cars are doing really well for absorbing. The cars built in the last 40 years have very good ride down time, whereas they break apart. Like people look at it and go, I can't believe it would survive that. That's because the cars absorb the energy so well before it gets to that third impact And then airbags on top of that. And then also we've, it used to be like in the 70s, 80s, nobody wore seatbelts. Now we're literally about 3/4 of the people actually wear seatbelts. So we don't see it as much as we used to. But we used to get pneumothorax. Now we see it most with ejections. We'll see pneumothorax with ejections. That and great vessel trauma, things like a pulmonary artery rupture. Like my first year as an EMT, I think I saw 3 pulmonary artery ruptures from chest hitting steering columns. But yeah, we just don't see that anymore. People walk away from wrecks. It's actually common now to walk away from a wreck if you're wearing a seatbelt and you're driving a reasonably modern car. Abdominal injuries, so solid organs. If you rupture solid organ, you're gonna bleed to death. You rupture hollow organs, you'll die of sepsis a couple weeks later. Any questions? Multi-systems trauma patients. All these are great. Don't try this at home. As German before, I think this is a bad idea. Stetson was a really good multi-systems trauma, especially for Valentine's Day. That's not how to have a good day. So I need everyone to pay attention to this video. Pay close attention to what the trauma surgeon has to say at the end. This is a survivable injury, even though she was shot and killed. If they could have gotten her into the trauma center to the surgeons, she would have survived. But unfortunately, even though Discovery Health is trying to make them out to heroes, the flight team and the ambulance team, they dicked around in the field. And if they hadn't gotten her in there, this would have been a survivable patient.
Surveillance becomes priority one. Classification means a life or death emergency. SWAT team's been trying to convince an armed woman to surrender. She's been on the scene by domestic disputes. Police entered her home. She's shot 3 times.
If you want to have any chance of saving your patient, never stop moving towards the hospital. Yes, you have all kinds of fancy tools and things that you can do. Never stop moving towards the hospital. You don't stop moving to do your fancy tools with your cool toys.
So now you're breathing on the first floor. Because of her irregular breathing, flight paramedic Cheeseman knows she's on the line between life and death. Her pulse returns, and she might have a chance. Charles Smith, a ground paramedic, joins the medevac crew for the flight to Charlotte. It's going to take 2 people to keep her alive. The second her heart stops, they must start chest compressions. If this woman has any chance at all, she's going to the right place. Baltimore's Adams County Shock Trauma Center. The golden hour of emergency medicine began, and she's there in less than 20 minutes. In the torso. We know that she has essentially no blood pressure. That means that she's bleeding to death. The only opportunity we have to save her is to stop her blood loss immediately. We'll take her directly to the operating room and take our best shot. So there you go. They start to lose her in the elevator. Cheeseman injects epinephrine into the tube in her neck, the fastest way to accelerate her heart rate. What we have time to do is take her to save her life.
Question?
The TV was following the whole time, and they're just trying to look super cool.
Yeah, no. When you get out in the field, you're gonna understand it's pretty bad all the way around out there. These guys aren't any different than anywhere else. We're trying to train people to be better.
But sometimes you just go look. And that's how you do it. You open your book and you start taking care of injuries in order of the likelihood and rapidity. So at the beginning, the issues are at least stop the bleeding, at least temporarily.
She have internal bleeding?
Yes, lots. Those containers full of blood is what they're suctioning out of her abdomen and her chest.
And that's why they couldn't control it at this.
Well, they waited too long to get her there. It's the problem. They couldn't-
Find all of
Take a surgeon to stop the bleeding.
in the hospital, and an incision on her chest and her abdomen, 3 minutes. If we look though, more things are linked than just the left liver, so that you should not be close trying to multiplicity of things that are chemical. Not sample much, takes too much time and distracts me. I'm very calm, I'm very focused. I've done this a lot of times, and it's about identifying levels. There are a number of maneuvers that all of us use to get at the areas to expose the blood vessels. And it's just a matter of moving with the greatest speed to the places you have to look. There's some things that are easy to see, you open them right in front of you, like the left lobe of the liver. And there's some things which are very difficult to see because you gotta move stuff out of the way in order to get to them. Hands from all sides, pack laparotomy towels into her chest cavity to soak up blood and put pressure on the bleeding sites. The towels hold the intestines aside to reveal her wounds. At some point, our hearts have to beat. Now we have several choices. We've just quit. Well, we know that in a very small number of people, and in fact, still save their life. The process of uncoupling life, and it takes place in each organ, and the organs are all connected. Think of it really as a chain reaction. When the heart fails, the kidneys don't get enough blood, and they begin to fail, and the liver begins to fail, and the lungs begin to fail. And all those put undue stress on the heart, and the heart begins to fail worse. And so it cycles in a direction that ultimately ends up with people dying. We got her ligated and fixed, and they can't control all of her blood loss. At some point, you look and you say, this just isn't gonna happen today. And when you realize it's just not gonna happen today, then you stop. And this, I think, is as discouraging as it gets, because we fixed our injuries. You didn't get here early enough for us to be able to save her life. It's terrible, terrible.
We're able to fix all of it.
Injuries, but, we had our, we just got a heart jump start, but, we know what the, survival is of people that have cardiac arrest in the field. And it's a very, very near.
Gotta get them there in under an hour. You can't stay in the back of the ambulance and do things. All right, blast injuries. So you get primary injuries from explosions, the direct energy wave, and it can actually rupture your hollow organs, your intestines and stuff. The pressure can actually blow them up inside without penetrating the skin. Then you get secondary injuries. That's the shrapnel, the glass, the rocks, and the pieces of whatever blew up. Everybody like ammonium nitrate? Hey. Hey, Rick. That would be the largest explosion ever come up. Yes.
So with cars that are crashed, how often do you see them like burst into flames or like how?
Crash and burn?
Yeah, how?
We had
frequent is
3 in
that?
one day a couple weeks ago,
That's pretty cool.
but not very often.
Okay, so it's not like it,
But it does happen.
yeah,
And usually it's all said and done by the time anybody gets there.
okay,
No, it's not like Hollywood with the roll down the cliff, then they detonate.
right, yeah.
But yes, but they do catch fire.
Alright,
People do burn it up inside vehicles. It does happen.
yeah.
All right, you guys ready to learn about the trauma system? So I know we went over this a little bit fast. The trauma system, the idea is to get people into surgery in under an hour, the most amount of people in the best way possible. And the structure of it, the effectiveness of trauma systems are completely different from state to state and county to county within each state. And it's all based off compensated shock. You can live past the first 5 minutes, you generally will live to about an hour. Then after that, you're in big trouble. So if you can get them into surgery within 1 hour of the time the accident happened, or the injury happened, you've got an excellent chance of survival. Any questions? After 1 hour, you should go to decompensated shock. And if you're in decompensated shock for too long, you'll be in irreversible shock. Any questions? A lot of misconceptions on what a golden hour is. A lot of people start the golden hour at the time they get dispatched. That's wrong. It's the time of the incident. Someone's got to recognize there's a problem. They got to call for help. Help's got to get routed to the right place through 911. It's got to get put into a dispatch system, then dispatch out the resource. That's usually about 7 minutes. if someone notices immediately. A lot of times they call Uncle George because he knew a paramedic once or a firefighter once. Then they call cousin Jethro. Finally, eventually, the third or fourth person calls 911. Now you're like 15 minutes out before phones are rolling. Then you got to stack your apparatus. You got to get there. Got to assess the package space. You got to contact the trauma center. Even a level 1 trauma center, which has a surgery team in house 24 hours a day, they need heads up. They're not playing pinochle waiting for you to bring them a patient. They're working on a patient literally all day and all night. So you want to try to give them about 20 minutes. They can assemble their team and be ready for it. Other misconceptions on golden hour. Misconceptions when you arrive at the hospital where the trauma team meets the patient. Those are both wrong. It's when they actually cut the body open and surgery begins. Any questions? So there will be some test questions on the different types of trauma centers. So we're going to start with level 1. That's the highest. Level 1 trauma center has a surgery team with a surgeon in the emergency room 24 hours a day, 7 days a week, 365 days a year, including Christmas. They have all phases of definitive care. That means that no matter who comes there and what service they need, they have every one of those services there. Level 1 trauma centers are outrageously expensive to run. And the trauma teams that are working on the patients get paid next to nothing, and it's still too expensive to run. The only level 1 trauma centers in this nation are at university hospitals. They're at medical schools. Every one of them. Any questions? Again, surgeon and surgery team, and it's usually residents, are in-house 24/7 in the emergency room. They have all phases of definitive care. All right, no questions on a level 1? All right, so there's no possible way that you can put a medical school in every community with a level 1 trauma center. It's just not going to happen. So for areas that can't do a level 1, you can go to a level 2. So level 2 is the same as a level 1, except you got to give them 20 minutes to assemble a team. The surgery team is a big deal to put together. It's about 20 people. It's a surgeon, surgical nurses, scrub techs, anesthesiologists, respiratory therapy, radiology, pharmacy, clerical. It's an entire team.
Surgeons.
Or there's multiple surgeons, orthopedic surgeon, vascular surgeons, ear, nose, and throat surgeon, depending on what's wrong. So anyway, you got to give them 20 minutes put together. So that means they're not in the hospital or in the ER 24/7 like level 1. A lot of them get stipends. They get an apartment a few blocks away from the hospital, and they work like 12-hour shifts. So they go home for 12 hours and come in if there's a call or an activation. Any questions? So any questions? There's between level 1 and level 2. All right, next, yes.
You were an EMT going for work to a hospital at that time.
You'd have to do that to a level 1 also, because again, they got to put the team together. The team will be working on patients. Every level 1 trauma center is in a 24-hour day state of triage. There's never that what's called journey garages. There's like literally hundreds of patients waiting to be seen. So you got to give them the earliest possible notifications so they can assemble the trauma team. They got to put everybody else on hold and wait for your patient to get there. So level 2 is the same thing, but they're actually not in-house. So yes, you got to give them the earliest possible notification. All right, so then the next phase down from that is a level 3. Level 3 is the same as level 2. They could get a surgery team together and stop you from bleeding to death in 20 minutes. But they may not have all phases of definitive care. They may not have cardiac surgery or neurosurgery or ear, nose, and throat. They may not have neurology or nephrology. But they can definitely stop you from bleeding to death. Okay.
does that, can they still do things like, really pressure from inside your skull and other things like that?
Drill a burr hole, usually. Yes.
And then as far as like after surgery care, they may not have like a rehab center or
You
something.
may
like
have to transfer them somewhere to get it done.
that. Okay.
Or say that a burr hole, if they like the pressure's not too great, they may transfer them down to someone's got a neurosurgeon, let the neurosurgeon do the burr hole. Then a level 4 is the next level down from that. And that's the same as level 3, but they can't get the team together in 20 minutes, or they may not have it available 7 days a week. And that's the lowest one. And usually it's like throwing a rock in a pond. You got a level 1, but outside of level 1, you got level 2s. The farther away from the cities you get, the lower it gets. Then you have level 3s and level 4s that are way out there. Any questions?
It's Fairchild level 4.
Fairchild's a level 4. Shasta is a level 3. Mercy Reading and Rogue Valley are level 2s. The closest level 1 to here is UC Davis in Sacramento. Next closest one after that is San Francisco General, which is run by UCSF down in the Mission District. Next one after that is Stanford at UCSF. Mission Emergency. Now I think now it's called Zuckerberg Hospital, because Zuckerberg gave them like $100 million to remodel it.
His wife is really nice.
Zuckerberg's,
Really nice, good dog.
but she's a doctor.
Yeah.
That's good. So, excellent question. The question was, what about pediatrics? So pediatrics have their own trauma center because they need to have pediatric surgeons. Those are even fewer and farther between. In all of Northern California, there's only one pediatric trauma center, and that is at UC Davis. Actually, there's only one pediatric trauma center, that is UC Davis. Now, UCSF has Benefit, which is a children's hospital, but I don't believe they are all considered a level 1 pediatric trauma center. They're not listed. So they don't have, so either they don't have them 24/7, or they got to call it, they got to call them in. It takes longer than 20 minutes to get the pediatric surgeons in. But Davis has all pediatric surgeons in and available in the ER.
There's none in SoCal at all.
No, I said Northern California.
Oh,
SoCal, they have the pictures outside on this wall right here. There's three level 1s right in Southern California. You got USC Medical Center, and then you've got Loma Linda. That's the one I couldn't think of. Loma Linda, and then the other one is UCLA. You're gonna take them to the closest trauma center. No, you're gonna take them to the closest trauma center.
Oh,
You're gonna stop them from bleeding to death. And then if they need something else, I'll give you an example. Ski park, a kid hit a tree once, he's 12 years old, and he was ruptured his aorta, it was oozing. So they wanted a pediatric cardiac surgeon to fix it, right? So the closest one's at UC Davis. Well, there ended up being a problem at UC Davis. So they held them in Mount Shasta, and the trauma surgeon in Mount Shasta had an aortic graft from a cadaver waiting to go on ice. So if it actually ruptured, he would have opened the kid's chest and grafted it right there. But they finally got one at Stanford came in, one of their pediatricians, they flew him directly to Stanford. Then he ended up not needing it at all. He healed on his own. But flew the kid to Stanford. And Stanford watched it for 5 days instead of doing an invasive surgery, and the kid healed on its own. Because kids do stuff like that. Yes.
is there anything with taking the patient out of like Torino or Bedford or something where we can't do that with health insurance stuff, or do they?
No.
There's no incentive to do the patient, like,
If it's an emergency, all insurances will pay for it.
someone gets hurt and he'll.
Well, you're always gonna go to the closest trauma facility.
We could still make it there, Jeff. Exactly.
He's from Hill, you're pretty close. There is one in Ashland.
Yeah, okay.
Ashland's not a trauma facility. I think Hill Road might be closer. I'd have to go look it up. I have to look when I'm there. Trying to think.
I guess I was just being like, out
It's close.
state service, if that's like.
No, it doesn't matter if you go to another state. Matter of fact, before we get into cardiacs, all the cardiac emergencies north of Weed Airport all go to Metro.
Mhm.
And like in Susanville, they all go to Reno.
Mhm.
So trauma team assembly is a big deal. If you as EMS activate a trauma system, you better know what you're doing. Because if you call it, they're going to put everyone in that hospital on hold and dedicate it, wait for your patient to get there. They have an entire team will wait for your patient. And you come in, there's gonna be 20 people in the room waiting for your patient. They're all gonna work on them at the same time. And that's how you get people in surgery with under an hour. They're gonna stop surgeries. The surgeons aren't sitting around waiting for you to bring them a trauma patient. They're doing surgeries around the clock. They stop doing surgery and they come down to the ER and wait for your patient. They pull people out of the CAT scanners and they hold the CAT scanner for your patient. Same thing with X-ray, same thing with respiratory. Everybody comes out of the ER and waits for your patient to get there if you activate the trauma system. Any questions?
You ever seen one get called in and then it's not needed?
All the freaking time.
That one of those things, don't do that.
Trying to get the more, it's the reason why I still do this, try to get as much education out there as possible to try to keep getting better. Don't control what other people do, but you can help make things better and help give as much education as you can possibly get. So early notification, even the level ones, is critically important. All right, so how do you know when to activate a trauma team? You have to have your Glasgow Coma scale memorized. You should have that down by now. You have to know it. All right, ready to learn about this? Oh, no. I need to update this. How did I fail? All right, so physiological and anatomical are what's called red box traumas. So if you activate a red box trauma, you're going to get the entire trauma team. So if the patient's got a trauma patient's got a respiratory rate of above 30 or below 10, it's an automatic activation. It's called the local closest trauma center, and you do a trauma activation. If there's systolic, if their respiration between 10 and 30, that's good. But if their blood pressure is below 90, you call. It's a red box trauma, automatic. Their systolic blood pressure is above 90, then you go to Glasgow Coma scale. If their Glasgow Coma scale is 13 or less, you activate the trauma system. If it is a person over the age of 65 that has had a head strike, it has a Glasgow of 14 or less, it's an automatic red box trauma. If they don't have any of those three things, that's a good thing. If they have any one of these three, they have a 90% chance of dying if they do not get surgical intervention. And you only need one of them. Any questions? All right, so then we go look at our physical assessment. Any penetrating trauma proximal to the elbows or proximal to the knees is a red box trauma. Anyone with a flailed chest, we haven't taught you about flailed chest yet because we haven't gone over chest trauma. Flailed chest is 3 consecutive ribs broken in 2 or more spots, which causes asymmetrical movement so you can't breathe adequately. Or a complete separation of the sternum from the rib cage. Between your humeruses and your femurs, 2 or more of those are broke, or if you're over 65 and one of them is broke, that's an activation. Unable to move any limb. any suspected pelvic fracture, and any amputation proximal to the wrist or proximal to the ankle. Those are your red box traumas.
Well, chest, so preconceptive rib or complete detachment. I just mean your respiration and everything just.
Goes,
Everything just moves.
right, it causes asymmetrical movement. So then you don't get equal inflation of the lungs, so it cuts your breathing ability by 50% right off the top.
50?
At least, yeah, if you lose half of, when you lose one lung. We get chest trauma, I got some good videos now, though. Unless they're not meeting community standards. Yes,
Is there gonna be a chapter on this? Because I don't believe this.
it's chapter 25.
It talks about.
It's on page 925.
Oh, thank
You drank red eyes, you know that. Oh, come on.
someday.
That comes to everybody, please take it, and let me eat it.
All right, so yellow box traumas. So that means that they're not gonna immediately die. Your red box is stuff that's gonna kill you in the hour. The yellow box means that you're probably not gonna die in an hour, but you've had some major stuff happen to you, or you're not a healthy person. We start with mechanism of injury. Getting tossed from a vehicle. You get ejected from a vehicle, you should be evaluated by a trauma team.
These are also red box, not the
No, this is yellow box. This is
That's
yellow
yellow
now.
box.
Now we're in yellow.
Okay.
So yellow box trauma, they may not activate the whole team. They may just have the surgeon wander down. They'll keep working on everybody else, keep the CAT scanners going, stuff like that. If somebody died in the same passenger compartment. So the reason why that's a big deal, and actually this is the #1 yellow box thing that people die from later. If someone died in the same vehicle as you, that means that you likely absorbed the same amount of energy that killed somebody else. Does that make sense? You should be evaluated by a surgeon team. Ignore the vehicle crash, taking longer than 20 minutes to execute. That no longer qualifies because it's just, that's old. Now it is 12 inches of intrusion in the passenger compartment or 18 inches of intrusion anywhere in the vehicle. 12 intrusion into the passenger compartment where the person was sitting, or 18 inches anywhere
Into the vehicle?
into the vehicle. Pretty significant. Yes,
About a year ago in McLeod, you know, the really long straight stretch.
on 89?
Yeah.
Yeah,
So a guy I know was going down there about 120 with 4 friends in the car plus himself. Everybody in the car died except for him.
Caught fire.
Yeah.
I was there.
Yeah.
It was bad. That was a bad day. It was a nighttime. It was late. Was it like midnight, 11 o'clock at night?
Yeah.
Yeah.
Pretty late.
That was really bad. Anyway, anyone that was hit by a vehicle at greater than 5 miles per hour. The vehicle traveling 5 miles per hour, not the pedestrian. Anyone separated from a motorcycle, jet ski, go-kart, rascal, mule, horse, traveling greater than 20 miles per hour, sheep. Falls over 20 feet free fall or 3 times the patient's height. These are all yellow box. Criteria, you only need one. Just different, they don't get as excited about yellow boxes as do red boxes. You need to still let them know, and then they'll be up to the trauma center to decide how they deal with it. Guys ready for the next slide?
Any videos today?
Probably.
On his friend.
I got a good bleeding video of a guy that stabs himself with sword by accident.
Do you have another nice cartoon video?
I don't know.
Balance it out.
If you listen to my ringtones on my phone, I love cartoons because they're all cartoons.
Yeah.
But
Cartoon.
Disneyland, it's a Disneyland Railroad. Disney's like the king of cartoons, the first cartoon movie ever made. Yeah, actually the full length, which is Snow White. What's that?
I was just referencing your dinosaur value.
Because I'm a dinosaur. Steamboat Willie was the first cartoon with sound.
It is now.
Yes, it is. All right, going to the next slide. Special patients. Anyone that's under 5 and difficult to evaluate due to their age. People over 55, dinosaurs. Anticoagulation or bleeding disorders or people that are on blood thinning medications, especially if they bump the head. 1 in 3 people that strike their head over the age of 65 on blood thinners develop an intracerebral bleed. People that have kidney failure. If you're pregnant more than 20 weeks gestation, or if you're morbidly obese. These people are not able to compensate for compensated shock as well as people that do not have these issues. Any questions?
This is good.
Yellow box.
Just under the special patient.
Well, it's all yellow box now. There is no more special H comorbid mechanism. It's just red box or yellow box. They had to simplify it for the lower tier EMTs and paramedics. Give them 2 categories instead of 4 categories. I think that it's easier. Less intimidating.
What were the old 4 categories?
Physiology, anatomical mechanism, and H comorbid.
Was it just different level, was there different levels? of
Still the same.
response?
Well, if it was physiology or anatomical, they would call it a level 1 trauma. And if it was mechanism or age comorbid, they call it a level 2. So now they just call them red box and yellow box.
This is all for people who had trauma.
Yes, trauma. It has nothing to do with medical. This is about stopping someone from bleeding to death in an hour. All right, moving on. Let's see what you guys have learned. You've been dispatched to a traffic collision. What do you do first when you get there?
BSI.
Scene size up. All right, you have your BSI on, CHPS traffic, the scene secured. It's a minivan that hit a flatbed 18-wheeler. You have 1 patient. You already have a rescue squad or an engine company with you. And you're looking at it, you're gonna definitely consider C-SPAN. What's next? Primary impression. Patient appears to be an unresponsive elderly male sitting in the driver's seat of the minivan. Your patient does not respond to verbal or painful stimuli. His chief complaint is he's unresponsive. He's got bloody secretions airway, so you suction immediately. He's breathing on 4 breaths a minute. Is that adequate?
No.
So not a breather?
Yeah.
No, BVM. Your patient does not have a radial pulse. He has a weak rapid carotid. The skin signs are pale, cool, and wet. Is this a priority patient?
Yes.
Does he meet trauma criteria?
Yes,
Why?
because he only has 4 breaths a minute.
Perfect. What do we do next? History. Nobody knows it. What's next?
And so,
Head to toe, blood pressure is 94/40, pulse rate's 132. Respirations are 4. Being assisted at 12.
I read that wrong. That said respiration of 132 other G.
Before the head to toe, would you take them out of the vehicle or scoop it out of the vehicle?
You just asked me to get the tiptoe taken out of the vehicle? I misunderstood that.
Before sample, would you take him? or
Yes,
Before head to toe, would you take him out of
Yes.
the vehicle?
we need to get moving.
Would you have them like in the back of the ambulance going to the hospital at this point?
Well, get them out as quickly as you can. So what's his Glasgow cone scales? Eyes don't open, he mumbles sounds you can't comprehend. And he withdraws from pain.
So is he making sounds?
He's making sounds you can't understand what he's saying.
7.
To patient withdraws. 4, that's 4, 5.
So what's his Jackson cone scale?
4, 2, 1, 7.
Excellent. 1, 2, 4. All right, he's got a large open laceration. His head, he's got crepitance on the left side of his chest. Equal lung sounds. He's got a firm distended abdomen, stable pelvic. He's got deformity to his left forearm. And he's actually improving on the second set of vital signs, which you're doing a good job with the bag. You're welcome.
Also, that video that was back.
Oh, yeah. They were excited. What's that? Discovery Health Channel. All right, any questions? All right, let's move on to bleeding. Bleeding. All right, thoughts for the day. Being upset or angry over what someone else has done or said is never going to help you reach your goals. Being angry at someone else. Instead of using energy on anger and disappointment, use that energy to take steps to becoming what you want to be and what you want to have. An emergency medical service is common for people to work the lowest common denominator, and it's frustrating as hell. And you will hear people say, if someone else does the minimum, why should they not do the minimum? My response is always, if it's your loved one's life's on the line, do you want someone there that's going to do the minimum? And if so, you don't want that person, then why do you want to be the person that you don't want to be there? Why are you doing this? Any questions? Never, ever do the minimum. Do 200% every day. Get better every day. Make sure every day you're better than you were yesterday. Any questions? Who wanted to see a video? This is a classic. Does anybody, how many people don't know what Home Shopping Network is? Because it's kind of becoming a thing of the past. Everybody seen Home Shopping Network? Yeah, this is from the old Home Shopping Network.
1101-1816 is the item number on this one. And the nice thing about these practice guitars, oh, that hurt. Oh, that hurt big time. A piece of that the tip just got me, Odell. Oh, that got me good. You all right? A piece of that tip just got me. Oh, right now, we may need emergency surgery in the studio.
Good old Odell. Huh?
Broke off.
Broke, man. The piece of garbage they were selling.
It's a real.
All right, so again, do not pretend to be something that you are not. This is an example of a person that was shot with a rubber bullet that caused a bruise and a scratch. It's not bleeding that they applied a tourniquet to. Because they're not actually medics, they're just pretending to be medics.
Hey, welcome to another video from Skinny Medic. So I have another after action medical report video for you. This was about 2 weeks old when it first hit the internet. Man, you guys blew my inbox up. The Skinny Medic Facebook group is going crazy over this one. So this should be a good one. Sorry for the delay getting to you guys. Life outside the internet has been pretty busy here recently. With that being said, I did pass my technician ham radio license. So I'm pretty excited about that. So let's take a look at this one. It's a good one.
Put the stuffing on his head, Breathe, breathe.
You're good, bro, you're good. Yeah, good.
You got PSI.
Good. Sorry.
Scratch. No idea what they're doing. Put a tourniquet on a scratch. They're trying to put an 8x10 with no gauze, no tape. Stop bleeding.
I'm sure it hurts, but it can't be the half and half.
So, what you think about that? I feel like there's this guy on the internet who says, "Oh my gosh, that's a lot of blood," is the indication for a tourniquet. I don't see a lot of blood. The guy keeps yelling, "Breathe, breathe, breathe." That's a good thing, okay? I'm making sure he's breathing.
You're good, bro, you're good.
You're good. Okay. Encouragement is good. Someone is putting a belt on, appears to be slightly painful. Belts have about a 50% success rate for improvised tourniquets. So I do feel like the best thing is direct pressure. But this isn't direct pressure. If we had a lot of blood here, controlling bleeding is about direct pressure, good pressure. Finding maybe the bony structure, pushing muscle mass down, gets the vein to arteries bleeding. Good solid direct pressure is what we're looking for to control bleeding, not absorbing blood. Tucking a 5x9 into the pants, maybe it looks nice and clean, professional, but it's just absorbing blood. You're not putting any direct pressure on there, hardly any. So major bleeding, put direct pressure, good direct pressure. Secondly, apply tourniquet. The other thing to take away here is belts. Okay, we see it on the internet a lot. It's about right there with tampons. Direct pressure is probably a better choice than trying to improvise a tourniquet if you don't have a good commercial grade tourniquet. So I hope this video helps. You never know when you'll be the first responder. Remember the right gear and the right training.
It's fine. All right. What is the definition of hemorrhage? It is bleeding. Your body can lose about 1/5 of its blood volume. After that, you're dead. In adults, that's about 1 liter, which is a lot of blood. In children, that's only about 100 to 200 milliliters, which is not a lot of blood. Any questions? Any questions? How do we know when someone's bleeding? We see it. Good assessment. No, if they're internally bleeding, then they're gonna have poor general appearance, poor skin signs, delayed capillary refill. And then if it's external bleeding, you're gonna see rapid blood loss. Well, you have to expose. No, it will tachycardia. A lot of things about tachycardia.
What about for the cerebral hemorrhage? Is it the same? What
Could they be great cardiac?
Cerebral hemorrhage, you're not gonna blow out for, because it tamponades itself with the pressure. So you don't bleed out from cerebral bleeding, but we'll go over that in head trauma. Yeah, and it crushes your brain and kills you that way. But at least you don't bleed to death. The characteristic of bleeding, you'll notice arterial was coming out bright red spurts every time the aortic valve opens. Blip, blip, blip. Venous bleeding is just smooth, flowing, red, dark red, deep purple. And capillaries of bleeding you see most of the time. That's when you give a scrape or a small cut. Bleeding is just out of your capillaries. Any questions? Yeah.
So with the direct pressure on like an uncontrolled bleed, like a hemorrhage situation, how does that ever stop the chain reaction?
So what it does is when you put direct pressure on, it
Yeah,
allows the platelets to stack together and form clots.
but does it like somehow alter the blood pressure itself from just
No.
like dropping too quickly? It just kind of
No,
provides
it's
more
all about getting the platelets joined together. That's why you use direct pressure.
barrier? Okay.
They even play the song "Come Together." Any questions? Feel like that was a good one. There's some drawings of capillary, venous, arterial. Any questions? Under normal platelet function, the bleeding should stop in about 10 minutes. There's a lot of anti-platelet, clotting drugs out there though, for people that are at risk for stroke. There's a rare condition called hemophilia, where their platelets don't work. That's really bad if they get hemophilia. Really? I don't know.
Yeah, there's like a big story.
I just know it skips a generation, so it's the female carries the gene from her father. But the males get it, so then her son will have hemophilia.
Yeah.
Then his daughter will carry the gene, the next son will have hemophilia. I had a buddy when I was growing up that had hemophilia. Blood transfusions. And he ended up dying of AIDS from blood transfusions. He was in his 30s, yeah. The kids are awful, like we go up there, it's like, hey, let's go smack Joe in the arm and see how bad it bruises. Hit him in the arm, his whole arm was bruised. Yeah, his parents would be furious. Kids are terrible.
And they're better precautions now.
I mean, there's nothing you can do about it.
Blood transfusion. That seems like that.
Yeah, they test it now, but the tests are only as good as the people that are competent enough testing.
Who's the person who has AIDS that's donating blood is my question.
What's that?
Who's the person who has AIDS and is donating blood?
The one that's doing it at the blood clinic to get $5 to go buy a bottle of booze or a thing of crack.
Okay.
That's exactly who it is.
Or the person doing it.
And the person that's testing for it, that's not really testing for it because they just want a job and they don't really care. Any questions? And unfortunately, that's the sad reality of it. All right, so about 20 years ago now, pretty close to 20 years, the military, after lots and lots and lots of trials that didn't work, finally came up with a drug called Quick Clot that even you as EMTs can now use. It's pretty good stuff.
Would it work on an hemophilia?
No,
What you're about to
because
see is an excerpt.
you
from
wouldn't order
testimony
hemophilia
from-
because it uses, it's Catalin, which enhances the function of your platelets. If your platelets aren't functioning, there's nothing to enhance.
Would you just have to like throw a tradition on it?
The United
Yeah.
States military to simulate the most severe battlefield
give them
injury
diesel.
imaginable. The complete bisection of the femoral artery and vein. The objective was to identify the field treatment that provides soldiers the best chance for survival. The following procedure was performed to test and compare the efficacy of currently available battlefield-appropriate hemostatic agents. Using subjects weighing approximately 110 pounds each, the trauma doctor slices through the soft tissue and all muscles throughout the vital groin area down to the femoral artery and vein.
Oh, yeah. Perfectly
The doctor
healthy
now
human being.
places his gloved hand over the wound to prevent the spurting of blood that occurs as he completely bisects the femoral artery and vein. The wound cavity is immediately flooded with blood. Suction is performed to measure the volume of blood loss as the hemorrhage is
How
allowed
fast
to
that
proceed
femoral artery is
uncontrolled to
bleeding out.
simulate the standard response time. If no action is taken, the subject will die due to exsanguination or bleed out, the leading cause of battlefield deaths. A single dose of quick clot, 3.5 ounces, is dumped directly onto the bleeding wound, and pressure is applied using the standard military dressing. Hemostasis is achieved almost immediately after applying quick clot to the trauma. After the gauze is removed from the wound, you can clearly see the quick clot. The top layer is untouched by the bleeding that normally would have saturated the pressure bandage. You can see quick clot is easily irrigated out of the wound, leaving behind a tenacious clot resulting from its rapid absorption of fluids. This allows the body's own natural clotting factors to become highly concentrated. The treatments tested included the standard military pressure dressing, Marine Polymers RDH bandage, Metaphor's Traumadex, and Z-Medica's Quick Clot. Quick Clot was the only treatment that reduced blood loss and increased survivability better than the standard military bandage. In fact, Quick Clot was the only treatment to achieve a 0 mortality rate or 100% survivability.
So did they give us quick clot now?
So now what they do is they take gauze, they coat the gauze with quick clot, and you just shove the gauze, you just pack the gauze in the quick clot on it, so you get both.
Okay.
Immediately take it a step farther.
Like patches and stuff, like.
No, not patches, it's gauze.
Sorry. Yeah.
No, not like that. That was first generation. Now they've gotten smarter. Now they just have gauze is completely immersed in it. You feed the gauze in, pack the wound with it. I think I had a video here. So yeah, they went through a whole bunch of stuff. So what Quick Clot does is it uses kaolin to work with your natural clotting ability. And jerks. Quick Clot gauze.
No wonder Steve Garvey wants to block Biden. This is progressive agenda and supports building Trump's border wall. Garvey stands for Trump.
Both times he was the best person for the job. I voted for him twice.
Steve Garvey is too conservative for California.
Hey, you too. Welcome to another video from Schematic. Just want to do a quick product
Let's
review
get
for
it
you.
out, yeah.
Demonstrate how you would use the Quick Clot Combat Gauze. This is a Z-fold, makes it easier for packing wounds. So I just want to open this up. I know this is expensive, so those of you guys who have this in your IFACs, your first aid kits, and haven't opened up, played with it, then this is what this video is for. This is the Quick Clot Combat Gauze. This is 3 inches by 4 yards. This is heat free, so it's not gonna cause the burns like the first generation Quick Clot granulars. So you don't have to worry about that. It does have the X-ray detectable strip running in it. That way, when they do X-rays, they can see where the material's at, because they'll have to get it all out eventually once the bleeding is controlled. And if you pack your wound good enough, then you'll be able to see the track of the wound through the X-ray. On the back here, it does have directions in case you forget how to apply it. So, but on the pictures, it shows it being applied just on top of the skin. And this does work better if you actually get it to the source of the bleeding. So you're going to pack the wound with it. And then you're going to wrap the pressure bandage after you've held pressure. It's got little tear tabs all the way, so you can tear at any point from the tear tabs. This is a Z-fold, so it's folded up, make it easier for when you're packing wounds. So you have to start and you gonna stick your finger into the source of the bleeding, whether that be an extremity, upper torso,
You gotta get it right
even
up
abdomen
against
or
where the
pelvis
vessel
areas.
ruptured.
So you wanna find the artery, the source of the major bleeding, and this gets tucked in. Just like this, you can actually use both hands here. So this finger goes here, here, and then you just continually put more gauze in at the source of the bleeding. This does have the quick clot hemostatic agent, which is gonna help control bleeding, as well as the gauze here itself is actually gonna help build clots to help the bleeding process. It's important if you are gonna pack the wound that you pack the wound completely and leave some overflowing. That way, when you put your bulky dressing down, it's actually gonna create more pressure onto the wound. So that may require us to use more than one pack of this combat gauze. If you pack the wound completely and this was enough and it bleeds through, then you need to pull this back out completely and start with a fresh roll because you didn't get it packed in tight enough, close enough to the source of the actual bleeding. Here's a little closer look at the gauze itself. And then this is the part that's x-rayed. This blue strip is what's going to be x-rayed. Like I said, if you pack this well enough into the wound, they can actually follow the track and see where it's tracking in the body. Once you pack the wound with it or leave it on top, the directions say to hold pressure for 3 to 5 minutes and then wrap it with a bandage. If you do choose to remove the product, then just gently remove it from the wound and irrigate the wound out with normal saline or sterile water. I hope this video helps. You never know when you'll be the first responder.
Yes.
So I understand what you're saying about completely removing the gauze because of the product that's on it to help it. But say with the hemorrhage, say we have a patient with a hemorrhage and we're trying to control the bleeding, and we have a tourniquet on, but it's still pulling through the gauze. From what I remember is we keep the first layer of the gauze
Right,
on
if it's not quick clot, but if it's quick clot, it's gotta be directly against the wound.
Okay.
So if you don't put it directly against the wound, it won't work.
But if it's normal gauze, we would still could keep that first layer.
Yeah, normal guys don't ever remove from the wound.
Okay.
That's a big no-no, but quick clot, you have to,
You will have to remove it.
if it doesn't stop the bleeding. All right, any questions? All right, let's see what you guys have learned. You've been dispatched to a female with a cut arm. What do you do first?
Control the bleeding.
BSI seat safe. BSI is on, law enforcement's on scene, appears to be safe. The patient appears to be very upset. Negative injury. Patient was locked out of her home by her mother. Ooh. So she punched the living room window, breaking the glass and cutting her arm. Good choices. Patients 1. You've got lots of emergency concerns, C-spine, but probably not necessary. What's next? Primary assessment. All right, Joe Brush, late 20s, early 30s female who's very upset. It appears to have significant bleeding. She's alert, complains of pain and bleeding to her right arm. Her airway is clear. Respiratory rate's good. Respiratory rate 20. And she has a rapid radial pulse. She's profusely bleeding from her left elbow. And she's pale, cool, and moist. Is she in compensated or decompensated shock? Very good, compensated. Is she a priority patient? What should we do first? Stop the bleed. All right, what comes after the primary assessment after you stop the bleeding? History. I already showed it to you. Signs and symptoms: cut arm. She's allergic to penicillin. She takes Effexor, Paxil, and Norco for depression and chronic pain. Last feels an hour ago. Bed sitting up to it. Mom locked her out of the house during a fight. She punched the window. What comes after history taking? Secondary assessment. Look at that blood pressure. Or it's 108. Restoration 16. What's her GCS? 15. Everything's negative, but that incision into her antecubital vein So we've already put a direct pressure and a tourniquet on that. And we got our second set of vital signs. Looks like she's still bleeding because her tachycardia actually got worse. Any questions? He has a tourniquet on her, so you put a TQ on her hip at the time, so it doesn't get missed, and you get her to the hospital. See how hard this stuff is? All right, so we're not gonna get all the way through this next presentation. It's gonna take the rest of tonight and all of Thursday. It's a very long presentation. It is also extremely graphic. Wait a minute, it's the wrong one. All right. Are you guys ready? All right, anybody can talk. Well, not anybody, only color people, but most everybody can talk. They can say stuff, they can tell others how great they are and how amazing they are. Takes minimal effort to talk and say things. But actions are what people notice, not words. Both your positive actions and your negative actions, people notice. Your actions are what define you, not your words. Always make sure your actions go above and beyond what comes out of your mouth. Any questions? All right, don't worry about the anatomy of the skin, the different types of soft tissue injuries, how to treat them. Why is the skin so important? Well, it gives us protection, stops viruses and bacteria from getting into us 24 hours a day. It also is our main thing for sensation, so we know what the things feel like around us. And it also regulates our temperature control, which is extremely important so we don't become heat stroked or hypothermic. Any questions? Skin is very, very important. You don't realize it, you don't have it. That is what the skin looks like if you cut it, put it under a microscope. Any questions? Here is the microbiology of skin.
Amanda hazırlanan biology and medicine videos. Please make sure to subscribe, join the forum group for the latest videos. Please visit Facebook. In this video, we're going to look at the skin, its structures, and some of the microbes that live on and within the skin. So the skin is the largest organ in our body. Here I'm just drawing a section of the skin. So this can be a section from our arm or forearm, for example. The skin is broadly divided into two layers. These are the epidermis and the dermis. There is a third layer, but it's not part of, it's not classified under the skin layers. And this is the subcutaneous layer, also known as the hypodermis. The hypodermis contains subcutaneous tissue. Subcutaneous tissue is essentially fat. Subcutaneous tissue provides for most of the body's fat storage and participates in thermoregulation. So when we're cold, it helps us heat up. And of course, we have blood vessels, veins, and arteries that supply our skin. Here is a hair follicle, which is essentially our hair. And connecting to the hair follicle are the sebaceous glands. Sebaceous glands are found all over the body except the palm and sole of our feet. It secretes sebum. Sebum will lubricate our hair and sort of waterproofs our skin. And it also is sebum is also effective as a defense mechanism against pathogens. Within the sebaceous glands and residing around the hair follicle, we actually have some commensal pathogens. Pathogens of the hair follicle and sebaceous glands are these rod-shaped bacteria known as Propionobacterium, which is a gram-positive. Now, what's interesting about the sebaceous glands is that it's stimulated actually by the presence of some hormones, such as androgens and testosterone. These will stimulate the sebaceous glands to produce more sebum and also causes, hypertrophy of the sebaceous glands. Connecting to the hair follicle, we have what's known as the erector pili muscle. This muscle essentially pulls the hair, and the phenomenon known as the goosebumps is due to this erector pili muscle contracting, which will pull our hair follicle, causing our hairs to stick up straight. Now, we talked about the sebaceous gland, but another important gland in our skin is known as the sweat gland. And as you may have guessed, it secretes sweat. But there are two types of sweat glands. These are the eccrine sweat glands and the apocrine sweat glands. The eccrine sweat glands are found in the palms of our hands and soles of our feet. They're also found in the forehead. The apocrine sweat glands are mainly found in the axillary and anogenital area. They actually become functional after we have a puberty stage. And of course, within the skin, we find nerves, and we find several types of nerves, which I won't go into, but that's just important to know. So now that we know a bit of the structures within the skin, let's look at some of the functions, the overall functions the skin does. So the skin, as I mentioned, is the largest organ in our body. The skin provides protection from the environment, such as from abrasion or from fluid loss. The skin is also like a containment for the body's structures and vital organs. The skin is important in heat regulation, and this is sweating, dilation, and constriction of blood vessels. The skin is important for sensation. As we have nerve endings on our skin, we can feel things, and this is quite important. The skin is also responsible for part of the synthesis and for the storage of vitamin D. The skin is also a blood reservoir, and it's important in the excretion of unwanted.
You have no idea how the skin can do all this.
So those were the main functions of the skin. So going back to our anatomy of the skin here, the structure. As I mentioned, the skin can be broadly divided into two layers, the epidermis and the dermis. Now the dermis is just made up of connective tissue, essentially. The epidermis is made up of epithelial cells. But the epidermis can actually be divided into different layers as well. So let's take a closer look. So here we're zooming into the epidermis layer. We have here the basement membrane that essentially connects the epithelial layer on top to the connective tissue layer down the bottom. The very first layer of the epidermis, closest to the dermis, is known as the stratum bacilli. The stratum bacilli is where we have epithelial cells that are dividing, and some of these new cells will move up. And these cells are able to divide because they're receiving blood supply from the dermis, and therefore they're able to divide. And so these cells, as they divide, some of them will migrate upwards to the top of the epidermis. The second layer on top of the stratum bacilli is the stratum spinosum. The stratum spinosum are where the epithelial cells are becoming keratinized because they're not receiving any blood vessels, any blood supply.
All right, you guys got all this?
There are also other cells found.
He's killing me.
Word for word.
You got an A in anatomy. All right, different types of soft tissue injuries. We've got closed injuries, open injuries, and burns. Closed injuries do not break the skin. Open injuries break the skin, and burns are when your skin absorbs more energy than it can disperse, and it damages the tissue. Questions? So biggest four types of closed injuries: contusions, most people call bruises; hematomas, which most people call hematomas; abrasions, most people call scrapes; and crush injuries, which most people call, oh God. Any questions? There's a contusion. Nothing like a picture to show you what it looks like.
So you have cruises that'll be like dark brown and that, then.
That's usually healing.
And then some are yellow.
That's even later stages of healing. So most of your bruises, at first, they're fresh, they're black. It's venous blood leaking into the subcutaneous tissue and the fat and the muscle.
Right.
And then as your body eventually starts getting rid of it, starts to turn brown. And then when it's almost gotten rid of most of it, it becomes yellow. And that's actually going to be really important when we start talking about child abuse. So you see bruises in different stages of healing. That means they're getting hit again and again and again, you've seen the different stages. So understanding the different progression of black versus brown versus yellow is really important.
Do they have the same way to feel like, does the yellow start on the outside of it?
I think so. I'll be honest, I have no idea attention.
Are there certain places on the body though where it would be a faster or slower coloration change of the healing, or like closer to the center, you feel faster versus?
Now, if I know. Hematomas. That's a good hematoma. That's blood directly below the epidermis. Stick a needle in that, it's gonna squirt blood like crazy. It's called lancing it. Yeah, that's an arm. No, not as an EMT.
Do you ever get really tempted to though?
No, no.
What do you do? Do you wrap it?
Nah, I just transport. I put ice on it, maybe for cold pack. Take him over here to Rob Sanchez. He'll go. He'll do it. Hey, Rob's retired. I don't know who the trainer is currently. I watched Rob Sanchez do it dozens of times here at COS. Oh, let me take care of that for you. Abrasion. There's an abrasion, also known as a scrape. And crush injuries never end well. If your thumb looks like that, it's probably not salvageable. That's necrosed tissue.
They're trying to salvage it.
When it gets crushed. What's that? Yeah, it's portable. Hey, want to see a guy get crushed?
Yes.
It's only for mature audiences. If you're immature, close your eyes. Look at the wheel. They're still in drive. First drive of the car is unresponsive. Huh? Yeah. First of the car is unresponsive. We are desperately trying to get that car off the poor guy. Agony, God. Don't get hit by an unresponsive driver. Jerks.
Oh, that's.
Oh.
Turn it into a trash bag.
That was bad.
That's a death.
This one's really bad. Yeah. No, I think this one kills her. I think this one's fatal. She crawls inside.
Oh, done. Oh,
I don't think she's
Done. Yeah, that's a non-survivable.
of course, that's in Japan.
Well,
3 out of 4 is not bad.
Questions?
Yeah.
When you're watching the first video, where you step in front of the car, that soon as possible, or?
Yeah, you gotta do an emergency move. You have to do airway, breathing, circulation, bleeding. Yeah.
There's no possibility of like, I'm just thinking of like, is it just? You don't want to take something out of the cause of bleeding.
Impaled objects you don't take out. We're gonna go over that. No. If it's definitive death, you don't touch it. It's evidence. Yep. The people with investigative authority for where the body's at. So what do you do for soft tissue and closed soft tissues? Secure the ABCs. Shouldn't be any external bleeding if it's closed. Center seats by an O2 and Rice's. Preferably Uncle Ben's. Just kidding, that's rice, rest, ice, compression, elevate. And splint. Any questions on what Rice's is? Also works very, very well if your cell phone gets dropped in the toilet.
So if you compress a fresh injury?
No. Nope. Yeah, good and round.
Above where you can turn it. You just.
Direct pressure. Quick clap.
Did we go ahead and turn this?
before we do quick clot?
Yeah, if it's an extremity, you're gonna tourniquet. Quick clot's for when you can't use a tourniquet. All right, let's go over open soft tissue injuries. Lacerations. That's actually a reasonably common lacerations pattern. Anybody know what that's from? No.
A wind turbine.
What?
A wind turbine.
It's close.
Motor on the boat.
Oh, a lawnmower.
No?
Snowblower.
Nope. Ooh, who said snow blower? What is, not necessarily a snow blower, but how does a snow blower blow snow? Industrial auger. That's more likely from agricultural, of having a hog or something like that that's jammed. So you get on top of it, you go unjam the auger. And then you're successful and that happens. And that also has to do with snow blowers. Usually with snow blowers, it's an arm. Because they stick their arm in there and try to clear the snow out of the chute. And then they have stored energy on the auger. And when they clear it, then the auger spins and it does that to their arm. And usually takes their digits off. Yeah. And it depends on what kind of snow blowers, because some snow blowers have double augers. They've got a horizontal auger and then they got a vertical auger in the chute.
I mean, if it's a snow blower, at least there's snow and you put their fingers in the snow.
Yeah, you can find them. Throws them across to the neighbor's yard.
What is crisis for?
For closed soft tissue injuries. Any questions?
Oh, I do have one.
Yes. Hey, Chatty Patties, hold up, can't hear.
Those butterfly like stitch situations, do you use that in the field?
No, let surgeons do it. We just put
Okay.
compression on it.
And like just gauze the frick out of it,
Yep.
compress, okay. So you're not trying to reclose anything.
Yeah, avulsions. Avulsions are when the skin's peeled back and still attached.
How often do you see that?
I've never seen anybody scalp like that before.
I've seen people's fingers.
From a large fall.
Huh?
Potato peel. From a high, like a high wall.
And that looks like machinery to me. It's clean. It could. I mean, you hit a rock hard enough and you're sliding. Yeah, it could. Oh, I've seen some pretty big avulsions before, but never on the head like that. That's wow.
Like a vehicle injection or something with.
I'm just trying to, he wrecked his motorcycle and slid on his head for a while.
Usually it rubs it off.
The one I ran into where it was somebody got ran twice.
Uh-huh.
And
It did that, but it was probably a scalp open though too.
oh,
Usually it crushes the head and pops the skull.
now you can see the skull perfectly fine.
Wow,
It's super weird.
that's impressive.
It's an unfortunate breakdown.
That's stabbing. That's like with a sickle. Somebody's got really angry there. That's some severe anger.
What's the difference between an incision and a laceration?
That is an excellent question. An incision has smooth edges, a laceration has jagged edges.
That looks like cut versus form.
Yes, exactly. Generally, an incision is done with a knife or a scalpel. Whereas in lacerations, yeah, it's a tearing thing, like you get caught on a jagged piece of metal or. Those are real pictures. I didn't like the penetrating wounds, were so fake in the book. So I thought I'd get some real ones. So the one on the left there, that's a improper use of a nail gun. And the one on the right, that's a prison shank.
Oh,
Oh, longer.
in the head?
All right, how does penetrating wounds like that happen?
There we go.
Great commercial. See this before?
Scissors.
Oh my God. I cannot believe this is fucking gonna kill me. I have to go to the fucking hospital. I have to go to the fucking hospital. There are fucking scissors sticking out of my fucking arm.
Oh. Gotta watch this one
What?
twice.
That was a good throw.
Damn good throw.
Yeah.
Oh my God. I cannot believe that this is fucking gonna kill me.
Killing that great dagger thrower many times.
There are fucking scissors sticking out of my fucking arm.
All right, so we're not gonna show your face here, but
This kid is brave. She is awesome. That is a bicycle handle in her thigh. And she's reading a book, and this kid's tough as nails.
we're not gonna show anybody's face on this. There's a lot of good looking women in this room, but these, you got clothes on, right? You don't give me that. And so, so you were riding your bike and you hit a pothole, is that correct?
Yeah.
Okay, and she can say, yeah, she's injured. She didn't have to. That's not the way she was. Even when you're laying in the bed in the emergency room, you gotta be.
Got her in.
Mom's gonna make sure you.
Never remove an impaled
Treat
object.
adults with respect. So, you don't have any problem with me, because I post these on YouTube as part of my training videos, and I'll show you, I'll give you a YouTube link if you want it. So.
Okay, I have no problem. If it can take someone else.
It will. So basically what we've done, what we're gonna do, so this is the brake handle on the bike. And so when EMS arrived, you were still attached to your bike, and then they were able to help, everybody was able to help separate the handle, cut the wire, break off the rest of the brake handle, and then deliver you to us. So we've given you some antibiotics, we've given you some pain medications, or we will be giving you antibiotics, and we're going to be calling the surgery team to come take a look at that. And they may make a decision on additional further studies. How old are you? 15. Okay. So I'm just going to get a close up of this.
That's in there pretty good.
You have no medical problems. You're obviously very athletic because you're out on your bike riding full speed and a high speed. And you look like a jockeyette too.
Nice side.
EMT student looks thrilled. EMS Academy. Here for my observation time.
So you want to tell me what you're doing on this?
Yeah, I'm just making something up here, but I'm just giving our tourniquet,
Okay.
just in case we need it,
In case it starts to bleed.
in case it starts to bleed.
All
This is,
right.
I mean, right here, sartorius should come from here all the way to there. Which is I guess the seamstress muscle.
Mhm.
And right under that sartorius is where the SFA lies. If this goes immediately to where it's in, I can hit the SFA vessel, but if it goes laterally, it's probably not even close to it.
Okay.
So,
But you did.
it does go laterally, we got an X-ray, and
Yeah.
it shows it's pretty superficial.
So you did the
Did an
ABI.
And ABIs are right at 1.1.
All right. So it doesn't appear to be
So it
any
doesn't seem like-
arterial injury.
Yeah.
You've done your homework.
Yeah, so let's,
So Child Life is here, keeping my patients distracted, doing a good job of that.
all right, just wiping it, I'm just wiping it.
And again, you don't mind this being on YouTube, okay? All right, I won't show her face.
We need a horse that rocks, and a horse that blows. And I think a rope and horse
It just caught on the skin here. Okay.
Let me do some body pain, right here, the skin, just because it's caught around there between the, do we have, some body pain?
Your eyes fine. We're gonna get a little Versed to try and calm her down. This is take the anxiety away.
Just froze the needle.
Yeah.
Yeah.
Yeah, that's good. So the vagal coolant actually throws the lidocaine in the needle.
Sponsored by Katie's.
Did you get a Versed yet? Okay. Yeah, is there's no additional elements here that would be stuck on that. Would be, there you go, there it is.
Souvenir.
Called the skin, so that's what's the pain was. Yeah.
Yeah, so irrigate that. Yeah, you just gonna leave that open to drain?
Yes.
Okay.
I think, I might just put a little packing in and then, or whoever.
What's your antibiotics?
Hey, can you get one of those, can you grab a blue chuck up there too, just to help absorb some of the water?
Yeah, graduate to the motorcycle now.
Yeah, come right down. So what are you gonna be when you grow up? I mean, as if she's already grown up,
I already said, not a doctor.
not a doctor.
So that's all.
Yeah, she is lucky.
It's the muscle.
Yeah, that's
That
pretty
muscle.
cool.
They're saying she got light, there's no nerve right there, there's no arteries.
I did.
A lot worse.
You did, okay.
Okay, I just told mom to pull it out tomorrow.
Okay.
Some low cheap, or work tech cheap way to cut it out.
And we can send her home with some gauze pads too. Yeah.
Yeah, you hear some of these things.
Yeah.
But yeah. Not gonna do much.
Yeah, just start showering tomorrow, or you can shower like normal.
Soap water, don't submerge it, don't soak it. Let the water run over it. It's gonna be sore to wash and scrub, so just let the water soak that right down our body on it.
Thank you. Good job.
All right, go to break. Down, down. 5 minutes after 8, ready to go to teams. We'll finish this presentation on Thursday.